I'm Chantel, and this is my husband Carlos, and we are here with our personal fertility guru, doctor.
Your new name now.
Yes, Dr. Verdiales. She is extremely instrumental in our journey with fertility, in vitro, and we recently took a trip with her down to Guadalajara, Mexico for a very new frontier experience of utilizing stem cell procedures. So we're gonna talk a little bit about that. But I'd like for Carlos to give a little bit of a background on who she is, as far as her incredible expertise, her journey in the medical field, working with women on their health, their fertility, their all kinds of things. You are just like a crazy wealth of information.
And a book.
And we keep learning more and more and more.
Yeah, so I'm just going to give a little background for those of you that are watching, because some of you may not know her at all, but you're going to want to get to know her for sure. So Dr. V, as we like to call her, completed her medical degree in Puerto Rico in 2001 before moving to New York City to specialize in gynecology. And during her residency, she was exposed to minimally invasive surgery and pelvic reconstruction, which became areas of particular interest. So after graduation, she continued to practice for a few years in New York and pursued further training in areas of robotic surgery and pelvic reconstruction, which I think is awesome. Can you tell us a little bit about that? Because I think it's so cool. Robotic stuff.
Absolutely. I like things to be pretty. I like to make everything pretty. That's why you've been to my office. I decorated it myself.
That's awesome.
My girls, they laugh because, I walk in after the weekend, after the cleaning crew comes in, and I'm like, that's crooked. That's not centered. So I go through the whole office. So I became very interested in making vaginas pretty and improve functionality, especially in older women, women that have had kids or because of job-related trauma or any other form of repetitive motion that had prolapse. And these are women that, it makes them feel bad about themselves, because the reality is if mama's vagina is not happy, the whole household is miserable. So,
and
they
it
don't
can be
feel
an insecurity.
Yes. I mean, when you start peeing on yourself, things are falling off, you don't feel much down there. You lose sensation because of nerve injury, maybe because of a traumatic birth injury. So I wanted to help them. I just felt, a drive to help them optimize their pelvic floor, their sexual health.
What a specialty.
I know, but at the end they were pretty. I was like, damn, that looks pretty.
Though?
What?
Where does robotics come in? Because that's fascinating to me, the technology.
I know, because that's new technology, and it allows the surgeon to do surgeries that normally would have to be opened up.
Oh, wow.
Okay, it expands the possibilities without having to necessarily cut open somebody. Also because the robot can diminish the human movement of the instruments. It diminishes pain post-op. So I was like, this is pretty cool stuff. So I went into that because, again, I like to do, and that's just the way I handle my surgeries in general. I was a seamstress in another life. I've done a lot of things.
Yeah, I guess so.
Yeah, so I actually was a theater major in college, and I used to work making costumes, and I, even from the age of 12, I was a seamstress. I was the youngest person in the class, and I did my senior prom dress and my wedding dress and all. So I like sewing things pretty and hiding things that you can't see what I did. It's an extra satisfaction that is priceless. So for me to, for example, be able to perform a surgery with a minimal amount of holes and hide the holes so it's not cosmetically unappealing. Same thing with my vaginal repairs. I then eventually got training on cosmetic gynecology and, people that had just because they want to look better down there, labioplasties and stuff like that. I'm very proud of them because I hide them such that you can't see the suture lines
Wow.
and all that
That's
stuff.
amazing.
Very cool. So then in 2009, Dr. V relocated to Georgia with her family to start a private practice, Restora Health. Was that when that was born?
No,
was
so
a little bit later?
Yes,
Okay.
that one was a little later.
Okay.
My first private practice was called Harris. Me and my crazy names. It's a theater, the artist in me. I decided that Hera was it's Zeus' wife in Greek mythology, and
Okay.
it's the goddess of fertility and womanhood. So I got really inspired with that, and that's what that was alive from 2009 to 2015.
And that's what you were just saying, because you gained a reputation for your expertise in minimally invasive surgery, just like you said with the robotics and then pelvic reconstruction. That's cool. Helped hundreds of women achieve optimal health. And then in recent years, she's also become a pioneer in the use of placenta stem cell treatments for fertility and other health conditions. And so that's what we're here to talk about today as well. And your passion too, I want to mention, for holistic health.
Yes.
Which led you to pursue advanced training in bioidentical hormone therapy. I'm going to get these things right.
Tongue
Nutrition,
twisters.
weight loss, integrative medicine. And she believes that optimal health is achieved with a balance between body, mind, soul. And her patients benefit from both cutting-edge technology and natural approaches to wellness. And here's her book, too. She's a writer and author. So it's The Healing Circle. Pretty awesome.
We're excited to read it.
Yes, thank you
She
for
just
that.
brought this as a gift for us, so we're
Yes.
excited about
Yeah,
that.
it's going to be awesome.
So
And
I
where
know
can
that,
they find this?
They can find it through my website, maribelverdiales.com, or at the office. And the phone number is 770-266-0933.
Yeah, thank you.
Cool.
That's so awesome. We'll make sure that number gets out there, too.
So, for people that are listening, they're probably going, what the hell is she thinking? And so I was sharing with them before we went live that everybody has a journey.
Yes.
Yeah.
And how did all the personal stuff brought me to this particular intersection that we have connected.
Mm-hmm.
And so my background, like I was saying, I was liberal arts, and I never thought that learning how to stitch clothes was going to help me to stitch people. But every experience we have leads you to the next adventure, and it all comes together. God, the universe doesn't waste a moment.
Right.
So yes, I became very interested in urogynecology and pelvic reconstruction early on in my career, and continued to train and to a lot of extra courses. And for the first 15 years of my career, that was the bulk of my practice. It was 35 plus, mostly 35 plus, and then one thing kind of led to the other, meaning that group usually will have endocrinology type of issues. The hormones are off, or the libido is off. And so I then started into the bioidentical and kind of endocrinology stuff to kind of continue to help the patients, because it frustrates me when somebody comes to me and I can't help them. I believe that problems and challenges are presented so we can actually go seek solutions. So if I don't know something, I'm going to find out, how can I help you? And if I find a block, then I will find out, because again, it's just how the universe is. There's nothing new out there. We just have not discovered it.
So good.
Right.
So true.
So can you explain the bioidentical, because for people
Right.
who aren't
Into this
world,
Yes.
it's
So
kind of like, what?
What the
Which, by the way, I have to mention, it's so rare to find an actual MD that's so balanced with like understanding medicine, but also holistic. That is super awesome. Thank you. Because it's super rare. I've been around a lot of doctors and not found that true balance like you have.
Thank
That's
you.
awesome.
There'll be more.
Yeah.
There will be more.
Yeah, you're just the pioneer. Go, go, go.
It's the hippie in me.
That's right. Come
Thinking
on.
outside the box.
Right.
So back when I was in medical school residency, menopausal symptoms were treated with mostly altered estrogens and progesterones. And I didn't know much at the time. And then they realized that some of these altered medications could cause other side effects. But the problems were still there. There was a huge study called the Women's Health Initiative that put a lot of darkness into the hormone replacement world. And then all doctors simply stopped postmenopausal women or perimenopausal women out of their hormones because they wanted to prevent cancer and cardiovascular disease without really digging into, okay, how are we going to help them? So from the more alternative world, they started exploring bioidentical hormones. What does that mean? That means that we're going to give you a molecule that's identical to the one you would create. Okay. Wow. And then also the delivery system is very important. So for example, the Women's Health Initiative were horse estrogens orally, which is a whole different monster to giving you, for example, transdermal or subcutaneous or intravaginal, or, there are different, it causes different effects on the body and different concentrations in the different tissues. So it's very important to understand this when you're helping somebody. Also, understanding that it's not just estrogen, progesterone. Like hormone replacement is a very extensive, because our endocrine system, starting in the pituitary, right? We've talked about oxytocin before. It's an integrated system. So you have to balance it out. So people that do bioidentical think that you need to make sure the thyroid is working, and if maybe replace the thyroid might fix some of the symptoms the person's having. How about the adrenal, the testosterones, the DHEA, which is a testosterone, mostly an androgen hormone, or testosterone if you want to call it that way, that is produced by the adrenals. I could get really complicated on this. There are different estrogens that you could use. Some are more active than others. So even on somebody with history of cancer, you can still offer them a less active estrogen given in lesser amounts and alleviate their symptoms, because it's about quality of life. It's not about surviving, it's about thriving, right? Whatever your scenario is. So I went into that because of some of the things that I was seeing and some of the complaints the patients were having, because like I said, when I was a student, it was like this and this, and that was it. Or nothing, and go die somewhere in a corner. And the reality is we want to live longer, younger. And so that's how I ended up doing the bioidentical stuff and becoming very versed on that, especially that I was handling older women past 35, perimenopausal, postpartum, that will mess you up your hormones, closer to menopause, right after menopause. I was dealing with women with all sorts of endocrine dysfunctions. So then that was part of my journey.
Crazy.
So in our previous video, we shared a little bit about the background and what brought us to work with you, which I truly believe was a divine appointment.
That's what I was going of, how did I end up doing stem cells, right? So she went to New York, became a gynecologist, and now she's doing stem cells. So there is logic to the madness, I promise. So after all of that, there's nothing like personal experience, right? And even though I grew up in the Caribbean, where it's very accepted to, treat stuff with herbs and this and that, my grandmother had all these medicinal herbs in the background, in their backyard, that I was familiar with, but I didn't question it or didn't think much of it. Once I went into traditional medicine, then I kind of moved away from natural health for a long, long time. However, in 2009, when I moved to Georgia, I was married to my second husband. I was pregnant with my fifth child. And he got diagnosed with stage 3C rectal cancer, so pretty advanced at the age of 37.
Wow. And
the doctors gave him 6 months of life, which was a hard pill to swallow for a pregnant 35-year-old.
Yeah.
What?
Yeah. And MD. Being a doctor. No way.
And so there was very little hope from the group of doctors that we started working with, and it was like bad news after bad news after bad news. And I'm a fighter. It's in me. And so I took it upon myself to learn what else can be done, how exactly cancer works, what is really cancer. I mean, people, even doctors, cancer is a bad word and you stay away from it. But, when it hits home, when a diagnosis like that hits home, you either keep hiding or you embrace it and really make it yours.
Figure it out. Yeah.
It's like, okay, I'm going to tackle this. I'm going to make it mine. I'm going to figure this thing out and we're going to fight it. So then I started learning about diet, nutrition, how the environment affects you, the stuff we clean ourselves with, the stuff we clean our house with. I mean, I went psychotic.
I can imagine.
The kids at the time, I think, I mean, I ended up getting my own chickens and, I went
Everything
all
had to be
in.
natural.
I was doing composting and had a garden. I went all in with it and really went into what else could I do to improve his quality of life and hopefully cure, right? So I started learning about herbs and experimenting with him, and I started seeing miracles. I started seeing him turn around, and it was not really the chemotherapy. That is the truth. And so he was given 6 months of life. He lasted 4 years. Yes,
goodness.
that was pretty amazing. So when I'm saying I saw miracles, the magic was in the combination of therapies. I learned a lot about what's out there for cancer in terms of the radiation alternatives, the chemotherapies alternative, the immunotherapy. Unfortunately, it was not until the last oncologist, which I love her to death. I mean, God forbid, that's what I send all my patients. That's where I would send my family. She was amazing, great bedside manners. She was on top of her game. So she gave us choices because a doctor is really a coach.
Yeah.
Absolutely.
He's a health coach.
Yeah.
So, unfortunately, she was the last one. So by the time we got to her, he had stage 4, pretty advanced. So she put him on some immune therapy that was not as rough on his body. They did genetic testing on his cancer that I was not even aware of when we started that you could do for targeted therapy.
Amazing.
We, on his second recurrence, we figure out something called gamma knife, where it is targeted radiation. Unfortunately, the first radiation he got was total pelvic, which was very brutal because of the permanent side effects afterwards. The damage was brutal afterwards.
Wow.
And so I became very familiar with that, and it changed me in every aspect of who I was. In terms of fear, when you are facing death in your house all the time, in your face, then you embrace death as well. Right. It's like, this is part of life. And as a doctor, I experienced the good and the bad and the ugly of the medical system as a person, as a wife.
Yes.
And then as a health provider, it just completely shifted the way I thought about medicine. And so I couldn't, because of my own values, I couldn't do this for my family and not do it for my patients. I believe that if it's something that I'm not willing to do for myself, then I should not recommend it to you. It's unethical. 100%. So, I started a little bit at a time. First it was just a few, diet modifications that I brought a few supplements, and then I got more comfortable. He passed December of 2013, and that's when I went head first and went back to school and really embraced learning about herbs, learning about manipulation of food to help certain areas of the body. There's an old philosopher that says, let food be thy medicine.
Yes.
Absolutely.
So, and then...
So there, a question real quick, because, I mean, this is crazy. We're totally off topic, but it's so good. So there's good education out there for holistic side of things when it comes to actual formal medicine.
There is. You have to. Things are a lot different. I started this journey back in 2009, 10 when my husband was sick, and I really had to fish a lot.
Yeah.
Actually, you said, oh, I was the only MD in every class I went to, and they looked at me like they were like,
what?
Oh my God! Wait, is that an MD behind your name?
Yeah, it's so
and
rare.
I would be the only one. There were all sorts of help, acupuncturists, chiropractors,
Right.
massage therapists,
right.
Even religious leaders,
Ministers, pastors,
everything,
Healers,
and then me, the MD,
The MD.
right? The MD. That has shifted.
Have you come over to the dark side, right? I mean, it's such a battle between the two worlds.
And the weird thing is, it was a dichotomy at the time.
Yeah.
Because for me, it has never been a dichotomy.
Yeah.
It's another tool in the toolbox, and I keep putting tools in the toolbox. So they would look at me, and then suddenly they wanted to be my friends, and I was the enemy. And it's like, well, we don't like the other ones. I'm like, okay, whatever. So, but that has shifted quite a bit in the last 10 years that I, 10 plus years that I've been in this journey, where now there's more and more, now I see nurses, now I see midwives, now I see MDs. They're they want to figure this out too. They realize that sometimes you find a dead wall, and if you care about your patients, you want to help. You're like, I can't fix this. Let me see, how can I fix this?
So
how can I help? Right?
Yep.
So that's what I'm saying. There'll be a swing in a more integrative approach of things. Now there's like even universities. There's, for example, University of Arizona under Andrew Whale, who was one of the first pioneers. He's an internal medicine doctor who became an integrative health practitioner. And there's a whole institute at the University of Arizona for integrative health.
Wow.
Nice.
For doctors, for MDs.
So what are they calling it?
What?
What is it called?
Integrative medicine.
Integrative
medicine.
Interesting name.
Yes.
So is that like a code word for holistic medicine?
There's
naturopathy.
Oh my God, there's so many. Look, integrative medicine, holistic, functional medicine.
Okay.
That's part of what I was trying to explain to you outside about how the PRP and the stem cells they shifted the names again.
Yeah.
So
it's all liability driven.
It's
somewhat.
It's a little bit of that. It's a little bit of, cliques, like little groups that get
right.
created.
You started talking about that.
So
and then we stopped you because we're like, let's get the recording started.
So, for example, now that you mentioned, so the chiropractors and non-MD people, they use more holistic integrative.
Yeah.
The MDs that want to, do a little bit more of the holistic, sometimes they'll use integrative, but they like to use functional. It's the same stuff. Right. So, anyway, so going back to how I ended up in stem cells, so part of the journey was understanding that our human bodies are perfect, and they were designed to heal themselves. And they were designed, if you give the body what the body needs, it wants to work as best as it can. So then I started going into what used to be called anti-aging medicine. You see?
That's where it's accepted first,
Anti-aging medicine back 10 years ago.
We're always looking for it.
And it was, this and that. But the ones who really grabbed onto that was more cosmetics.
Yeah.
Okay?
Right.
And so the more medicine-oriented doctors that wanted to embrace some of these techniques like the PRP, because PRP actually got famous because people did not want wrinkles.
So can you explain PRP?
Absolutely.
And for me, PRP versus Botox, right?
Absolutely.
Because those are two different worlds.
Different worlds, yes.
Okay. Yeah, I'm curious.
Yes.
Man, we're going to be here all day long.
Oh, my goodness.
We're going to have to cut this into like 5 series. We're going all different directions. We'll get to it, I promise.
So,
thank you, by the way.
Yes. So anti-aging was much more into the cosmetic part of things.
Yes.
All right. And it's about looking good.
Sure.
Making you look good. So whichever way you need to do it, with fillers, Botox, and then that you were using PRP for resurfacing, getting some of the wrinkles out, getting some of the stains. PRP stands for platelet-rich plasma. And it was first discovered in the 50s and 60s through the hematologists, and it was being used for some blood disorders, some clotting disorders, platelet-rich plasma.
Just want to make sure I heard that right. Platelet-rich plasma.
Yes.
Okay.
And so
Liquid gold.
Yeah.
Liquid gold.
We got a picture of it.
Yes.
I was like, that's crazy to me.
We call
Yes.
it liquid gold.
Yes.
Yeah. Anyway,
It's
sorry.
like there's so many mysteries in our
Squirrel.
bodies.
Yeah.
But
Yeah.
what it is the growth factors and the healing factors that are attached to the platelets that are your first aid when you have a cut,
Okay.
right? It stimulates your own stem cells, your own collagen and elastin, reproduction to heal an injury.
Okay.
But what we realize is that if we harvest those proteins from your body, concentrate them, and manipulate them, put them where we want it, we can elicit the same response and provoke your own stem cells in that area, your own healing in terms of like skin. We can get rid of scars because it causes, especially if you cause a little control insult and kind of break the scar down, it'll go and restructure the collagen and the elastin
Cool.
to be more the way it was before the injury.
So wrinkle scars, kind of.
Yes.
See? Oh. I didn't even know that. I
So-
just made it up, but it worked. I
So
was
then
right.
PRP was starting, it got used by the maxillofacial doctors. So you would, so you would heal fast from implants. Ortho uses a lot of PRP because they realize, well, implants
I can
here,
imagine.
implants in the joints,
Yeah,
so you don't
sure.
have a rejection.
Yeah. sense.
And so when the different areas of medicine started noticing the benefit, then they grabbed onto it. It is FDA approved for maxillofacial, for ortho. It's not quite there in gynecology. It's accepted, but for example,
Functional.
it's
I am trying to learn more.
no, if it's FDA approved, then insurance can pay for it. If it's not FDA approved, the insurance will be like experimental.
Yeah.
But at least it can be done legally. It's accepted
Here in the States.
in the States for
So I had it
gynecology.
done
Mm-hmm.
after you removed polyps.
Correct.
Okay, maybe explain a little bit about
Absolutely.
That's perfect.
Yes. So I like to do it post-op on all my patients. Why? Same thing. Accelerated healing, avoid scarring. So if I take out something wherever, the body, it's going to create a scar, or potentially could create a scar if it can't heal fast enough. So then with the PRP, I'm trying to avoid scar production and elicit all the processes in the body to elicit accelerated healing. So I recommend all of my post-op patients to have PRP afterwards. In terms of fertility, there's a lot of data on it. I have a lot of experience with it in fertility because I learned about it back with the vampire facelift and the cosmetic stuff, because I went into cosmetics too.
Yeah, of course
Okay.
you did.
Because, I like making things
Pretty.
pretty.
Yep,
I
of
was going to
course.
say.
Seamstress, girly girl.
And I took some courses on cosmetic gynecology, and they used to call it, which face are you going to fix? The girls have two faces.
Yeah.
Anyway, because it's the
Wow.
same techniques up and down.
Wow.
And so I was like, more tools in the toolbox.
There
Come
you
on,
go.
bring it on.
There you go.
So back to you had polyps. Polyps are like
little growth,
on-
like
on
little
the
growths in
ovaries,
the. You can have polyps anywhere in
hers
the.
happen to be on the ovaries.
It happened to
Chantal.
be in the uterus.
Oh, uterus.
Yeah.
So it's a little growth. It's a sign of inflammation.
It's so interesting. I got to tell you a little story about that. Like, I'm really weird about this stuff. And when they told me about that, I'm like, what? And then I was like, we're not going to do any kind of, because I thought they wanted to do some kind of technique on it that was like medicine. Because I tend to lean towards more natural and holistic. Remember that? That girl was like, well, what if we just go on with in vitro and not do it? What would that hurt? Natural, because I was trying to keep it as natural as possible. And then I got to meet you through that process. I'm glad we did it. But at first I was fighting against it because I'm like all about holistic.
I get everybody fight me about it. I mean, think about it. The doctors think I'm crazy.
Yeah, you're in the middle. You're
I'm
crazy
in
on
the
both
mid-
sides,
I'm,
girl.
I'm crazy on both
You
sides.
get it from all ends.
On all ends. But
You're
it's-
doing surgery and you're giving holistic like pills, like
Yeah, it's like,
naturopath. Like, wait,
what?
you can do surgery and you can give me
Yes.
holistic medicine and
That's
natural.
where the magic happens.
That's amazing.
right.
Yeah.
So
So
then with PRP in fertility, it's used for ovarian rejuvenation, for healing the uterus, for people going through IVF that have lining issues is fantastic. For example, when some women, whether they did it on purpose or not on purpose, they could get scars inside the uterus. So when I
Okay.
cut those scars, when you cut scars, you can create more scars.
Mm,
So I
makes
try
sense.
to treat it with PRP so the uterus heals open.
Wow. Okay.
And
So
I
yeah,
have
she got her polyps removed, and then you did PRP. Do you actually inject it into the
uterus.
Okay.
Mm-hmm.
So pretty much like helps it to heal itself
Correct.
with
And
her own blood
with her own,
and
you
blood
know,
cells
her
and
own
PRP.
signals, her own signals.
Wow.
And so
Doesn't get any more natural than that.
that's
really.
good. It's good stuff. And so you asked briefly about the difference between Botox, the
Yeah.
anti-aging, the cosmetics.
Yeah.
So what happened is a new area was created
Okay.
as medical doctors wanted to use these techniques to help heal or function of the
Yeah.
organs, and now it's called regenerative medicine.
Yes.
Of course.
And part of that is cell therapy.
Gotcha.
Okay.
Wow.
So the difference between Botox and PRP
Okay.
is that Botox paralyzes your muscle.
Okay.
Okay. It doesn't help really your skin.
Okay.
All right. I think it's going to eventually make it worse because when you paralyze a muscle, you cause atrophy. So
Okay.
temporarily you might look better, but at the end you're going to start aging faster.
Okay.
And while PRP and some of the other modalities, it's about rejuvenation,
Regeneration.
Gotcha.
rejuvenation. It's about helping you reverse aging or age slower.
Wow.
Right.
Increase functionality of all of your organs, including your skin.
Amazing. Amazing. Amazing.
So
Okay.
powerful.
So, truly divine appointment to get to work with you. Super blessed that all came about. But before we get into the questions, because we do have some actual questions about stem cell, can you explain the placenta stem cell treatment process in kind of general terms, and then explain specifically what you did during Chantel's procedure?
Absolutely.
Got all up in there, and it was an actual like
Absolutely.
surgical procedure with needles.
Yes. So, PRP, it's amazing. I love it. I usually like it's candy, but it has its limitations. Okay. One, it is your blood, right?
Okay.
So
44-year-old blood.
it is your age,
Yeah.
right? It is your blood. It is your age.
Yeah.
Two, those platelets live in the same body that the patient is, right? And some patients will be sicker than others, autoimmune,
Okay.
history of cancer, history of whatever, blah, 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 smoking, blah, 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 blah.
Does that go back to the DNA?
That goes back to the environment that your body is,
Okay.
not so much the DNA
All right.
portion. And so I have found that it does have certain limits, especially on people with very low biological reserve. Okay. If it's a matter of somebody that's fairly young and they need a push, PRP is incredible. I have one of my nurses. She was losing a lot of hair postpartum. Her hormones go a little crazy. She had one treatment of hair PRP, and it was like, poof. But she's 31
Right.
and
Gotcha.
generally healthy, while you can have somebody that's a little older and is going to need multiple therapies. So the response gets, I've never seen anybody do bad with PRP. I've only had one patient have a reaction to the anticoagulant that we use to keep it liquid.
Right.
However, what I have seen is, depending on the biological reserve, and that's very important, that term, biological reserve, the response gets smaller.
Okay.
Okay, where it's
So when you say biological reserve, that is
for example, infertility, when you get somebody that is, the ovarian reserve is very, very low, it's going to be really hard to get that boost with PRP.
Right.
There's not enough oomph in that body, in those ovaries, to get those signals to do much, because they're stimulating your own stem cells. They're stimulating your own healing process. And PRP is dead. It's very important. PRP is just your signals. I'm harvesting your signals and putting them to kind of stimulate your body. But if your body doesn't have anything to give, nothing is going to happen.
So which would be what we experienced with our first cycle.
Yes.
Right? Because we've talked about our first cycle.
Yep.
That we did the retrieval and we did PRP and then we did the fresh transfer and it didn't take. So
But we did get 3 eggs,
Right, we did.
and 2 became
Embryos.
embryos. Yeah.
Yes.
Just didn't take in the uterus. Didn't
Yes.
stay. They
So,
didn't survive.
yes. Now you're following me. So me being the little feisty Latina, I'm like, I want to help these women.
Yeah.
It's like there has to be something else. Once you go the rabbit hole, you keep like, right? So I said, okay, so PRP takes me here.
Yep.
That's it. That's all I'm gonna get.
And again, it's the what'd you call it? The biological
It's your biological signals.
signals. That's what's a
Okay.
key element. Biological signals.
And it's dead.
Okay.
I mean, that's the reality. It doesn't have any live cells in it.
Right.
All right. So then I started, hearing the buzzword stem cells. I was like, okay, that sounds interesting. So then I started research. I've been researching stem cells for a year on how it works, why, where they're getting, blah, 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 blah. All those questions I had myself, right?
Yeah.
Because think about it. I believe that I should try it first before I tell you to go
love
try
that.
it. So it took me a year to say I'm going to do it. At first, I was a little skeptical because I was like, man, that's somebody else's DNA. I don't know if I want that on my body. And so, and then there was the ethical question, where are they getting this stem cells?
Exactly.
You
Yep.
know,
One
all
of the
those
questions,
all
right?
those questions. I'm like, I don't really know about this. And unfortunately, it's very limited, the information that we get in the United States. And
By design.
it's,
We can say that by design.
but I want it, but I don't have, I can travel to figure
Right.
this
Yep,
stuff out.
That's right.
And so I started looking at meetings or congresses or, to go and learn about it,
Right.
and hear it from the experts. And as you know, I am married to a wonderful Mexican papacito.
Yes, Ricardo. I love him. He's awesome.
So
Glad we got to meet him.
yeah, so then it happened to be that in my, stem cells, meetings, stem cells congresses,
Wow.
boom, Mexico came up. And I was like, oh, check it out, Cancun. I could do that. So December of last year, I signed up for a regenerative medicine seminar,
Okay.
which was like super exciting to me because it was
Yeah.
all of it.
The word
Come
regenerative.
on,
You're
the
like,
good
yes, that's what I'm
stuff.
always looking for.
And so I got a lot of information, international speakers. My brain was like,
Where were most of them from? I'm just curious.
all over.
But not the
Europe.
U.S.?
No.
Okay, that's just what I wanted to clarify. Unfortunately,
Europe,
it's
South
real.
America,
Okay.
Mexico.
Okay.
Like, for example, I learned quite a bit from the medical director from the Barcelona soccer team.
Wow.
That was a cool
Ooh,
lecture, but I
yeah.
won't deviate on that one. And then Dr. Nadio came up.
Yes.
He
that's
was
the
the
name.
speaker. He was
That's
the
the name.
speaker for
Yep.
stem cells, and his lecture was first an introduction and then their use on COVID patients.
Oh.
Of course.
And so I sat in the back and heard the whole lecture. He was very knowledgeable. I felt very comfortable with his knowledge level. He talked about things that talked to me. For example, he said that it's very important because this is, even in those countries, it's still experimental.
Right.
Yep.
That is very important when you pick your stem cells to make sure you go to the right place and they don't put, water in the IV. And make sure where they're getting their stem cells, that all the quality control measures are there. He explained in his first lecture all of the quality control measures from his lab. He said that not only are they have all the permits from their FDA version, which is the Cofepris, but they're also certified internationally. I thought, okay, I can live with that one.
Yeah.
He explained that he has quality control in his lab internally and third party. I was like, okay, that's my type of people.
Wow. Yeah.
And that he has multiple published papers on the quality of his cells and the effect on patients. And that was the second lecture on COVID. They have a published paper on terminal ill COVID patients that were not responding to traditional therapy, if you can have traditional therapy in COVID, but they were in the ICU.
Okay.
And this was last resource. So this was given in conjunction with the antibiotics and all the other stuff. And 4 out of 5 patients survived.
Wow.
Where they were heading down the hole.
That's amazing.
Dang.
And so I was like, oh my God, I need to know more about this. So I did, and this was just on IV infusions. So I did ask about my area of expertise. I'm like,
Another
anything
rabbit
on
trail.
fertility? And so he was like, there's very little data on
Right.
this. We have data on on diabetes and
Right.
organ type of failure and reversing some of the damage. So can you imagine my brain went beam, beam, beam,
Oh,
beam, beam?
yeah.
Because I'm like,
Reproductive organs.
right.
They're organs.
If you're healing kidneys and hearts and pancreas
Absolutely.
and livers, we can
Duh.
heal something else.
Yeah.
So
And autism, brains, right?
yes,
Healing
that's
brains
right.
even.
There's a lot of data on brain and how
Amazing.
with cell therapy, the stem cells themselves don't cross the brain blood barrier, but the exosomes do. And then
It's all science.
they-
Man.
it's
so
very
technical.
cool stuff. So they
It
actually
sounds so
go
cool.
and stimulate the neurons, the immature neurons, to reproduce and heal and create new mature neurons. So it's really cool stuff. And
Wow.
they have an anti-inflammatory effect in the brain. So it's being also explored for anxiety and depression, which is really cool stuff as well. But anyway, so after the lectures, we met and I kind of explained who I was and what my purpose of being there was. And he's
Yeah.
like, we should work together. I would love to have a collaboration because, he doesn't personally see patients anymore. He's the director of the lab. And so he's in academia, doing the research and the papers and he travels quite a bit.
And what was his background? This is Dr.
Yes,
Nario.
Dr. Nario. He's
Nario.
internal medicine with a specialty in geriatrics,
Okay.
which makes sense why most of his
Regenerative,
research is on Alzheimer and organ diabetes, heart disease, cancer.
Okay.
He has a lot of research on cancer. So because that's kind of his expertise.
Right.
But he was very excited at the possibility of using his cells in experimenting with fertility and gynecology type of stuff. So
I bet he was just like, he just like fell in my lap. Like, let's do
do
this.
I was
Because
like,
there's different. Can you just like define in very simple layman terms what stem cell? You hear it's like almost like a
buzzword.
buzzword,
Yeah.
right? Stem
Yes.
cell. But there's so many. There's different kinds of stem cell. Like I did a little
Yes.
background
Yes.
research on this, and I'm like,
woo.
man, I had no clue.
Yes.
But can you give us just like a definition?
Yes, so there are levels, right?
Okay.
And so you can have a stem cell at the level of the zygote. What does that mean? The wording is like, I think it's total potential or whatever. So that means that cell can become a complete human.
Okay.
All right. And then there are layers. The next layer is a stem cells that can become any tissue. Then you have the next layer, which is a stem cell that heals. For example, it's already, because cells differentiate, they start specializing, okay, in the branches. Imagine it's like a tree, like an inverted tree. And so depending on where the level is, then that's where the specialty of that stem cell. So eventually, for example, you're going to have kidney stem cells, right? They call basal cells, ovarian stem cells.
That created your kidney.
Right, but those are the ones that regenerate your kidney.
Okay.
They're always there because once it's fully differentiated, that cell is mature, and unless it's manipulated, because it can be manipulated, but in your body, it's not going to go backwards. It's going to keep aging and dying.
Gotcha.
But the one that replaces that is your basal stem cell for that organ.
Okay.
All right.
Gotcha. I think I'm kind of following. Now, is this where it gets in really weird conflict about even cloning then?
Yeah.
Okay. So this is that world.
Yes.
So they're trying to make it sound good with saying stem cell instead of cloning.
What
type
happens
thing?
is that you can manipulate a cell.
Okay.
Okay. And because your DNA is in every single cell of your body, and it has to do on how it's configured and what genes are turned on and off.
Okay.
You can manipulate a cell to think it's a zygote. But that's like hours and hours of discussion. Okay. You're like, woo.
Yeah.
So, and that's how they started cloning. They took a mature cell from the lamb, from Dolly.
Okay.
They took the nucleus, put it into a embryologic cell.
Okay.
So the nucleus in this new environment was like, oh, I'm back to zero. So it kind of reprogrammed itself.
So it regrew itself essentially.
It went backwards like, okay, I'm back to zero, and regrew a whole animal.
Okay. So, but do they still have different DNA though?
Nope.
So their DNA is actually the same.
Correct.
Interesting. See,
Yes.
I don't know this world, but it's pretty
it's
fascinating.
a cool stuff.
Trip.
So,
But there's a lot of ethics that goes into this.
yes.
But at least we know what now a stem cell is. It's a thing that could
Correct.
actually reproduce you. That's taken out of you essentially, or from something. Okay.
Or for something. So they started experimenting on embryologic stem cells first.
Okay.
All right. But what they realized was that in the cascade, remember, from being one cell, those cells were very immature.
As they're duplicating.
Yes. So remember I told you that you get the one cell human, and then it becomes the embryo, blah, 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 right? So they were experimenting with embryos and blast type of cells.
Okay.
All right. So embryologic cells. But those were total potential cells, right? They were immature cells, immature stem cells, if you want to call it that way. And the reason they went there is because, oh my God, super stem cells. But what they realized is because of the developmental stage of that cell, they did not behave as a mature stem cell and did not respect other tissues. So they were creating cancers. They were growing in wrong places.
Oh my goodness.
And so it was like, whoa, not there.
Yeah.
Right? Yes, sometimes we get the good effect. And what happens when it goes left instead of right? Right?
On haywire.
Because they realized, no, this is an immature stem cell. Yes, it has it has like more potential.
It's like it hasn't made up its mind of what kind of thing it's going to become.
Wow. Yes. So what they
realized
is they needed mature stem cells.
Okay.
The other factor was that an embryologic stem cell, because it is really designed to be a human being, it will elicit all of the protein signatures that identifies it as a human being, as a individual, right? Yeah. But then that will cause an autoimmune reaction.
Right.
Gotcha.
Because
your body
would
reject it.
Right, because it's going to identify it.
So which is why when you get a heart transplant or some major organ, you have to take the medicine to keep you from rejecting it.
Correct.
Okay.
Because it's like, this is not me. This is foreign. So they realize, okay, not only it gives cancers, it causes autoimmune reactions, right? Or host versus graft reactions. Right. So then they went back on the drawing board. What's the best next thing to the fetus? The placenta. And you look back at, I think that there's so much wisdom in our Asian texts and habits and how placentas have been in many cultures.
What's the umbilical cord too? Was that first before the placenta?
They use both.
Okay.
They use both. So the placenta has been veneered. I mean, animals eat their own placenta.
Exactly.
Yes, that's what I was when we talked about this. I was like, I watched our heifer. She was a heifer at the time, but then had babies, so she wasn't anymore. I think that's it. But anyways, she had this baby, and then here is a grass-eating cow eating her placenta, and I was like, what is wrong with her? I look it up. I'm like, that is what all animals do except for humans.
Correct. And so there must be something there.
That's right. God is trying to. Here's your sign.
Oh, yoo-hoo!
Well, we have.
God's like,
truthfully, we have been breaking down the placenta and putting it in capsules and taking
but you know, for a long time it was trash.
Right.
And in actually most places it's still trash.
Wow.
So they went back to the trash, okay, and they realized when they started that they were mature stem cells. So now we got rid of all the cancers and the crazy cells.
Right.
And they were the same age as the baby. That means we're back to day 0, right?
Wow.
You want a healthy, young day 0 cell. And they do not elicit, they do not express all of the signature proteins, right? Because the placenta is the buffer between the mom and the baby. It has to be neutral. It has to be not ejected by the mother.
Okay.
So they do not cause that reaction. They will have certain proteins, and that's part of the quality control.
Yeah.
And I don't know all the names of the proteins. They have names, of course, scientists and biochemists. And so that's how they know that the cells they get from the placenta are what they're looking for.
Okay.
But those particular signals will not trigger your immune system.
Okay.
And so that's how we ended up with the placenta. And so the question is where these placentas come from. The placentas are donated placentas from young, healthy moms that ended up with a healthy pregnancy. They get screened. Like a donor egg mom gets screened, you know, all the genetic testing, all of the infectious diseases, make sure they're completely good. And then that's how they get harvested. They're taken to the lab and they're reproduced in a petri dish, pretty much. It's a special flask.
Yeah. Okay. Because I guess the rumor is that it can come from women that have abortions.
No, they did research on it, but they realized they got burned.
Yeah.
Wow.
Big time burned. So that's not done anymore.
Yeah, that's good, and I think that's important because it is a buzz out there too. It's not unethical because they're using aborted.
So, they did try,
placenta.
but they realized that that's not where the gold was, and we can talk about.
Okay,
why
so what was the procedure? Let's talk about
the good stuff.
What was done on Chantel? So. I had it too as well. I got the IV. I got the shot in the booty, which we got that on video, which was funny as heck. It's funny because a lot of guys complain about that. I'm like, man, that feels not so bad because I have pain there. So I was like, no big deal. But for Chantel, she got the IV. She got the shot in the booty.
Yes. So now, remember I was explaining platelet-rich plasma.
Yes.
It's not alive. Now, these are alive cells.
Right.
They have a humming device, and then they go find inflammation. They work through 3 pathways. One is they're anti-inflammatory because of the little vesicles, which are the exosomes they excrete. They go and reprogram your cells so they start working better, and so they modify something called program apoptosis. That's the word I was looking for. And they also do paracrine function, meaning they excrete certain proteins again to facilitate the function of the body, and they regulate the immune system to not attack the sick tissue. Because there's autoimmune reaction that happens when you have a sick organ. It sometimes gets identified as foreign because it's sick, and then your immune system attacks it, not what we call subclinical, not like head on, but just like bzz, bzz.
Right.
Have you seen in nature
Trying
where
to flush it out?
Try to flush it out. Have you seen in nature where maybe there's a dog has a lot of babies and there's one that's not doing so good. Eventually it gets bullied and pushed away. So that's kind of how nature works. So your immune system, if it detects a deteriorating organ, there's a subclinical autoimmune reaction.
Wow. Okay.
So that gets down-regulated, and so the body has a chance to heal, to really heal. I like to see the stem cell therapy like, remember, I told you there's going to be a point where I can't do much with PRP because he's not alive.
Right.
So it's kind of like somebody that had a heart attack, right? The heart stops working. You can do CPR, but the chances of that heart kicking back up, it's less, right?
Yeah.
It's a
And
lot
functioning
less.
properly.
You know, and that's where the electric shock is an outside source of energy comes in and kickstarts it, right? And then it goes back into rhythm. So that's how I feel about it. It's like, here I am bringing a young, alive, full of energy, intelligent cell into your body to go reprogram and tell your body that maybe forgot a little bit how to work.
Remind it.
It's like, hey guys, focus. This is what we're gonna do here. And so it's kind of that little extra, like that battery. It's like, oh, okay, this is what I'm supposed to be doing.
Wow.
And so
That's why she was like, we need to do this for your ovaries.
yes,
And that's what's crazy too, is you're so awesome. Like you said, you've done this on yourself.
I have.
The treatment on yourself first. To me, that's amazing. And
I've had two actually. My husband was a little upset about my last little experiment. We've been debating because I want to have more, and he's like, "You're not having more." I'm like,
more what?
More stem cells.
Oh, I thought you meant babies.
Ah.
Because we're talking about fertility here. I was like, what?
That too.
Maybe. So So I wanted to. So I got 100 million the first round, so the same dose you did.
Okay.
I did notice some things, unusual things. There's actually a video with me and the IV. I got a little loopy, and I got a little bit of headache. I broke my left ankle twice, and it kind of flared up. I was like, oh, that's interesting. My hips flared up, which after pushing 5 kids out, I can see that happening. And then I noticed some unusual changes, for example, and this is something that everybody has said, they feel like they get more mental clarity. I think it's the exosomes. Because I got the stem cells, the exosomes, and the peptides.
That's the peptides in the booty.
Yes, the placental peptides. So I noticed more mental clarity. I noticed that obviously my kidneys need a little bit of help because I stopped peeing at night.
Wow.
I was like, yes, I'm sleeping through the night.
Nice.
Wow.
And I used to blame it. It's like, oh, my bladder, the 5 babies. No, baby, I had a kidney issue and I didn't even know it, I noticed that my friend, my own JJ, it's happier.
Smiling more?
Yes, it's definitely saying hi.
Prettier.
It's prettier,
Ricardo!
younger.
Saying his name more.
That too.
Leave it to relationship
Yes.
coaches. We always talk about sex here.
Yes. So I noticed that what happens with age is that women tend to lose their natural moisture.
Yeah.
And that, I talk about sex all the time too. So, I usually recommend certain lubricants. My personal, and the one I recommend is coconut oil. It is edible. It doesn't interfere. It doesn't interfere with, so that's the one I use and recommend. Natural. It doesn't interfere with anything. It protects the pH. Anyway, I can talk about it. But anyway. So I noticed I was more moist, like I was in my 20s, like my undies were getting more discharge, more stuff, and then the sexual response was better. That was a plus. I was like, oh, I haven't felt this way in a while.
Get over here.
Oh my god. Yeah.
Oh, Ricardo. His name is perfect for that.
I know, because you can. He's gonna die.
You're welcome. You're welcome.
He's gonna die. I love you, honey.
We're talking
I
about
miss
you,
I
Ricardo.
know, man. So back to this. Back to reality. Okay, squirrels. That's a good squirrel though. It's good for people to hear that. Peptides in the booty, and then what was in the IV?
Exosomes.
Exosomes. Okay.
So exosomes, they call it the cell therapy without the cells because it doesn't have DNA in it. They're vesicles created by the stem cells. They're tiny, okay? So it's almost like the stem cells sends it their little, robots, the signals. So it creates a little bit of a vesicle, and it goes a lot faster, and it goes everywhere. And it produces similar effects that the stem cells will produce. They just last shorter because they're not alive. So it's
Shelf life, if you
transient.
would.
Yes, it's a transient
Okay.
effect, or their lifespan is a lot transient.
Okay.
So, and that's the one that it's really good for any brain issues
Okay.
because it'll
Very
cross that barrier. And so I think that.
And I got the peptides. I really felt a difference after that. That was amazing
Huge.
to me.
I
And
love
it's
it.
still getting better.
Yes,
That's the cool part.
And the data shows that it can continue up to 8 months.
Wow. I'm telling you, I'm always like, kind of like, wait. Because I have an uncle, who's an MD. He's probably going to watch this. And I respect him so much. And he talks so much about placebo effects, right? So I'm very aware of that from my uncle. He's awesome like that. But it's real. And I understand it and agree with it. And I think it's good. And he thinks it's good.
Yeah.
So, I mean, obviously your body, like we say, if you want it, if you want to receive it, you're going to receive it even more.
Absolutely.
And I want it bad. But the reality of it is like, it doesn't matter if I want it bad. If I was on my feet for 15, 20 minutes, I had to stretch because my hip hurt so bad, So it's like, now it's like, whoa, I mean, I'm watching, I'm like looking at the time, like, it's
I
been
feel
45 minutes.
I know.
Wait, it's okay.
Yes.
I'm starting to feel it now. But from 15 minutes to 45 minutes, and it's getting longer and longer.
And that's why I
want
to keep experimenting on myself because, I realized with the first stem cell therapy, of course, you don't know what to expect, and you want it to be amazing, like shit, like oh my god, who am
where's
I?
my cape? For me, it's Superman.
Right? Woo-hoo. But I was like, this isn't the effect was like this is worth keep going, right? And it's accumulative because that's what regenerative medicine is about. It's causing that anti-aging, reversing damage, aging related damage. So. And it's accumulative. So it's like I've had 2 treatments and hopefully I'll have my 3rd soon. And so I notice improvement in different parts of my body. Not like it's not a miracle cure.
Right.
But I don't think that ever really happens. But it's like it's enough for me to say this is worth doing a few.
Right.
And by seeing how all of the pioneers respond and I respond, then we'll be able to tell other people what to expect, in what time frame, how many treatments. So we're in that process, and I'm super excited about it.
So what did you shoot into her ovaries?
Yes. So this is all me and Dr. Nadio putting it all together.
Coming up with some kind of
protocol, right?
Recipe here,
Recipe,
if you would,
yes. So we still did the IV because they're intelligent and they will go everywhere. And remember, let's say you have a thyroid issue, kidney issue, anywhere else in your body, ovaries and testicles are what we call end organ and luxuries. So your body, it's going to direct healing more towards essential organs than non-essential.
Yeah,
so we still need, and when I talk to the fertility patients, like, I want this now, it's like, look, we need to address your overall health.
Wow. Because you need to live first before you reproduce.
Yes,
I mean, even naturally.
it's a luxury.
Right?
Yeah, it's a luxury.
Absolutely.
So that makes
if
sense.
your body is in survival mode because it's barely making it, it doesn't want you reproducing. And that's one of the symptoms that I see when people are sick. They lose their libido. Sex and reproduction.
And then even
are luxuries.
testosterone drops. So that could be an actual health issue instead of them addressing and taking stuff for that.
So you have to address everything else because you are a full organism. You're an intelligent, full community. Okay. So that's why I decided I'm going to do the full thing because it'll go everywhere else.
Right.
That needs, thyroid. Thyroid is super linked to that, and pituitary, blah, 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 blah. And then now I'm going to take your PRP. Remember, those are your signals. And I'm going to tell not only your body, but these alive cells where I want them. It's like,
Oh, so you like,
the beacon
did
is
you
the
put
PRP.
some exomes in her PRP?
No. So what we did is
That sounds kind of cool.
Now that was went through the IV.
That was nice.
So what I did is I took her PRP and diluted the stem cells in it. That
So the peptides, or is it a
the
different
peptide
one?
goes in the butt.
Okay, so what kind is it then? Is there a name for it? The
What do
kind that you put into her ovaries and uterus? The
It
kind
was
of
the
stem
mix.
cells?
Oh, it was the mesenchymal, so meaning the mature
Okay.
placental stem cells. So she got some in the IV
Okay,
and some into her pelvis.
okay, gotcha.
Okay.
So, but
And
you call them
together
peptides and exomes. The exomes went in the IV.
Yes. So
Peptides
they're
went in the
okay.
booty.
So let's take it back a step. So you have the cells, which are called mesenchymal stem cells.
Okay,
All right, which are mature stem cells derived from placenta or from cord.
okay.
All right, they can be used almost interchangeably. I mean, some people think the cord is better, but I think they're about the same. So, and then you have the exosomes. The exosomes are not cells; they
Okay.
are vesicles derived from the stem cells. So, okay,
Like messengers. you said.
messengers,
Okay,
little
okay.
fast. Okay,
Gotcha.
you go, my messenger, right? With a set like a little robot. Go.
Yeah.
The peptides are the protein and healing factors extracted from the placenta, from the
Okay.
meat of the placenta,
Okay.
and
Cool.
then
You
that
got
gets
me.
put on the
Yep.
booty
Okay, I'm
as
following.
a not only growth factors and blah 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 blah, but also raw material. So remember, I'm telling your body to heal, so I'm giving it raw material to go heal.
Gotcha. So then now you took blood from Chantel, spun it down to PRP, which is the platelet-rich
plasma.
plasma. Okay. And then what'd you put in that and then inject it in?
Yes,
Is that what you're
and
saying?
then I
Okay.
put stem cells.
Okay.
Right? A little cocktail with love.
Yeah.
Cocktail,
Okay,
little love
okay.
cocktail.
But
And-
again, this is new. Like
Yeah.
it's not like
It's
I mean you've done it with
brand
some
new.
of your other patients, but as far as
Yeah.
okay.
So we were the second trip you took
You-
down.
Yep.
second
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 trip down.
pioneers.
Second pioneers.
second group of lab rats, which is probably bad to say, but sorry, maybe we can take that out. I don't know. I
I've
just
already
said that
said it
about
several
myself. I've
times.
said it about myself, and I think it's hilarious. Like,
Pioneers.
pioneers, yes.
Pioneers.
We're the
It
pioneers.
is.
yes.
It is. You know, and it is the pioneers that changed the world.
It's amazing, and you know, again, it's not like they had labels on it. You know, we just trust the process, trust the medical people you're working with. It's real.
Mm-hmm.
I mean, it is, and you did it first, so it's like, well,
Yep.
you don't have an extra eye or a
I
third
don't.
ear.
Good thing we
And
trust
that,
you.
Oh, by the way, that was my second experiment. So my second experiment on myself. So I got 100 million.
Right.
All right. And I told Dr. Nadio, I want to go up. I see what happens when I get a bomb.
300 million, right?
So he said, well, I mean, the most that we've put in somebody is 300 million.
Yeah.
I mean, and we did that like on a rescue measure on a very sick cancer patient. I mean, that's a lot. And I was like, okay, well, maybe that's a lot. And so we came up with 200. So the second round, I got 200 million, the exosomes, the shot, the whole 9 yard. And I did it while I was a little sick,
Okay.
or I was
Some flu
recuperating from.
symptoms,
Yep,
okay.
I was kind of recuperating from like a stomach bug,
Okay.
and I experienced on my skin the reaction of the stem cells, which was one of your questions.
Yeah. Yeah. What's the
It
side
hit
effects?
me like a rock. It kind of flared up, like it was like, my immune system on crack.
Wow.
Mm.
Okay.
Boom. So, and then Dr. Nadia was laughing at me afterwards. Because, I try to, I didn't want to worry because I was with my kids and Ricardo, and I didn't want them to be worried. So
Right.
I was like, I had a fever and a brutal headache, and I'm walking through the mall. Oh, that's beautiful, sweetheart.
Oh gosh.
Wow.
Finally, I couldn't take. By the time we got to the Airbnb that we're in, I was like, I'm gonna freaking die. I had nausea. I could barely eat at the restaurant. I took a shower, and there's something about being sick in the shower, and then you go.
Mm-hmm.
Cleansing.
And
Yep.
finally, I come up clean. I'm like, Ricardo, I don't feel good.
Uh-oh.
And he goes, I knew it.
What'd you do?
Why? I was like, I mean, every bone hurt. I felt like I had the COVID. Every bone hurt. My hips hurt. The fever. I was
Aches
like
and
beat up,
pains.
ache, pains, the stomach. I he grabbed some like chicken soup. I could barely.
Was this like the same day or probably
Same
next
day.
day? Okay.
It was
Then-
like gradual. The
Gotcha.
fever hit about 3 hours in.
Okay.
And then I was like freaking out. I'm like, oh my God, I need to get on an international flight tomorrow and I have work on the next day. What the hell? But of course, this is all in my head. I'm not
Right.
admitting this in public.
Right.
Well,
Or to your husband.
Now she
Right, now I did.
It's like, oops.
but you know, I'm like
It's
trying to
out.
fake it for everybody but I'm like, oh, I'm going to work on Monday. I'm going to die. Well, I went to sleep, slept the whole night, woke up as good as new. And then afterwards, I did talk to Dr. Naudi about it, and he was laughing. He's like, "Oh yeah, 3 hours the fever, then it hits you hard." He goes, "That syndrome lasts about 10, max 12 hours after the injection, and it's directly related to the dose, and two, your overall health." And so the nurses were telling me some horror stories of like the sick patients, they can pass out. Like, for example, she was saying that there was this couple that came and they both had type 1 diabetes. So kind of sick people.
Yeah.
And that they had from palpitations, sweating, their bodies just kind of, holy,
Wow.
Your system
So
just
that's why
goes,
they observe you
freaks
for
out.
a little
Yes,
while.
yes,
Okay.
because you're like, are you okay? And then they give you a little bit at a time to see how you respond. The
Okay.
healthier you are, the less feeling of it, the less symptoms you're gonna get.
Has there ever been delayed of it? A delayed reaction?
Usually no.
I
Usually
just
about
wondered
30.
because we felt great afterwards.
No.
But then
Usually
on
it's
the way
like
home,
30,
when-
like 30 minutes into the transfusion, you start
Gotcha.
feeling something, and depending on how your body reacts, then it could be up to the 10 hours he was
Gotcha.
saying, which I
Okay.
had the wonders of experiencing. But now that I know I will survive, I would
You're
definitely
ready for more.
yes,
Right.
because maybe TMI, like my daughter's is like, Mom, you're such a cringer. Anyway, I noticed improved. So all the stuff that I got improved the first round went kind of to the next level, and my I've always had like bowel problems.
Okay.
Very frail stomach, bouts of constipation. And things are definitely like
Flowing.
working much better.
Nice.
So whatever needed,
That's important.
yes, and my husband, because I didn't notice, for many years, it was kind of an allergic, the cough, the morning cough, and whether it was allergies or maybe it was gut related, it's like completely gone. He's like,
Wow.
you're not coughing anymore, and you're not like that, phlegm thing going on. I was like, that's true. After 20 plus years, it's gone.
Wow.
So I'm like, what else can
What
we
else
do?
is happening?
What else?
So tell me about your ankle, right? Like, because you broke your ankle twice, and so
It flared
those-
up, and now it's, it feels fine. But I did notice that it did flare up during the first transfusion. It just felt a little weird. And my hips felt a little weird too.
For how long?
About an hour.
Gotcha.
And you're here and you're healthy and strong and you got over it quick. Like you went to work Monday.
Yes, I
Everything's
survived.
fine.
So, so we did this, and because in February we had to stop a cycle,
Mm-hmm.
right? Because my
You were not responding.
I was not
Yep.
responding. So this was your suggestion, and because we trust you, we decided to go down and pioneer and have this amazing experience. So what are your expectations for our situation, our specific
scenario.
journey?
So I think that we're just seeing the beginning of what's going to happen. That has been the trend. We've had how many people? 11 people, and 2 of them actually went back for more treatment.
Yeah, we got to meet them.
So what I have seen is that there has been this gradual improvement tangible, gradual improvement for all of them. On the first trip, we had a 50-year-old woman who had not had a period in a few months, so she's going through the changes, and because of her religious beliefs, she doesn't really want donor eggs, and so, or she can't, and she had a spontaneous ovulation and a period.
Wow.
Which I'm like, that's a victory. So I think that we haven't seen the extent of the improvement yet, and I think that we should have, with your next IVF, we should have even better results than even with the first one. So I am expecting maybe 5, 6 eggs, 3, 4 embryos, and
that's awesome. Yes, the miracle baby.
Because we just recently Monday we did a baseline.
That's right.
Yes.
So exciting.
And the results are in from the
Yes.
baseline. So just in this very short period,
Your
because it's only
time.
been like 2.5 weeks.
Yes.
3 weeks.
But
3
actually,
weeks.
since you did your last AMH test, which AMH is what?
Anti-Mullerian hormone. It's one of the markers for ovarian reserve.
Okay, but you had told us, this is what's so interesting, when we talked to you, I remember that phone call. We were at one of our retreats, actually, when we had that phone call with you, when the pregnancy test was negative, because that's the whole part of this whole thing. Like, you go
Of
through this
course.
process, and we're praying that she's going to be pregnant, and there's 2 embryos in there, right? And then you give us the call, and you're like, you're not pregnant. Sorry.
It
Like,
hits
and then,
like a rock.
yeah, and you're like, oh my goodness, the pregnancy test, the blood test is negative. She'd already started her period a little bit anyway, so we kind of thought that, but then that was confirmation. But then you said, and by the way, your AMH levels, this is understandable. And I remember saying to you, like, okay, it may take 10 times doing this. And I'm like, okay, we're in it for the long haul. Like, okay,
Yes.
let's do this. Like, we're going to make this happen, like, whatever it takes, right?
The
And
question was, what can we do to raise the AMH?
the AMH, I
levels?
remember that question. You're
Yes.
like, it just doesn't happen. Usually when your AMH goes down, it stays down, right? Is that
so-
typical?
Let her explain
Yeah.
that.
So, okay. When I talk to my patients, I need to be real and optimistic at the same time.
Tough job.
And
Tough
it's a very thin line.
Mhm.
Why? Because I have to tell you, as an MD,
Right.
what the stats are for
Mhm.
the MD world and what the chances are, because otherwise that would be unethical as well.
Right. Of course.
So I have to tell you, okay, we are seeking a miracle.
Mm-hmm.
What is recommended by the National Reproductive Group and all of the GYN in the world is that she goes through donor eggs.
Yep. Because you're looking for the
Which
golden
is
egg.
the answer that all of the women in their 40s are getting.
That's right, because that's what, there actually, when I was in residency, anybody past 42 was simply not even allowed.
Wow.
Not even, it was not even a choice. It's like, no, we're not going
Not
to
an
take you.
option.
Either
Yeah.
you do donor eggs or get out of our office. There's still some clinics that will do that because it messes their stats. I mean, that's
Gotcha.
something that even
Like
though
their
I don't.
success rate. when you
Yes,
say
because
stats.
Yeah,
because
exactly.
IVF is kind of like a boutique cosmetic stuff, and people are crazy about the stats and success rate,
Sure.
which I understand, but at the same time, a lot of them are manipulated, which is a whole different ball game. But and even though like I don't agree with everything that Dr. Kiltz thinks or says, I feel very much in alignment that
Yeah.
he wants to serve as many people as possible
Oh, yeah, it's
and
awesome.
allow people to get to their conclusions on their own, right? But at the same time, I have to present, or we have to present, the reality.
Right.
Now, once that's explained,
Right.
okay, then I can give you the alternative choices. Because again, I am your health coach.
Right.
And my role in your lives is for me to be the best health coach that I can be.
Yeah.
That's why I'm always learning.
Mm-hmm.
But at the end, this is your life to live, and you
Yeah.
only got once. YOLO,
Mhm.
right?
Mm-hmm.
So I'm giving you choices. I'm giving you the stats, the realistic situation, but I also want to give you these other alternatives and
Right.
kind of put it in your court. Say,
Yeah.
hey, do you want to take the challenge? I will walk with you until you're
Right.
done,
Mm-hmm.
Mm-hmm.
right? But I have to be realistic about
Right.
it. And the chances of it going up is very low. Have I seen it going up? Yes, we just saw it go up.
Yeah, and that's what I'm saying.
We
That's
just saw
what's
it.
so powerful.
It is powerful, and it happens. But I could not only get in trouble for not giving you
Right.
the standard of care answer, but it's also unethical not to
Right.
give you the standard of care answer.
Right.
Yeah.
And I usually will start the conversation with that, right, to get the cards out on the table, and especially because I see patients that are on their IVF number 9,
Yeah.
right, and I still have to say, let's look at this. What's more important? What are you willing to do?
Yep.
So that's what that conversation.
It was interesting when we had that conversation with you. I was like, so you're saying we got a chance?
Yes.
We got to do it. At least I know I got 10 rounds of this stuff.
Yes.
And somewhere in there,
And
we're going to find the golden egg. I remember you saying, I'm like, okay, we're on a treasure hunt.
Yes. So I'm all about going for the golden eggs, but at the same time, it is not my suffering. It's not my body going through it. It's not even my bank account going
That's
through it.
Right.
You know what I'm saying?
Right.
But when somebody takes the challenge, I get like, yes, let's do it. Let's, whatever it
Well,
takes.
we've been presented with that about the donor eggs or whatever, even our daughter potentially, that could be an option because she has similar DNA. But I was like, no, it's not about that. It's the exact combination of you and me. That's what I want to see. That's what's important to me. So it's whatever it takes.
And what I tell, because again, I speak to a lot of people, and your situation is not as drastic as somebody else's.
Sure.
Believe it or not, that has become my specialty. 40
Of
plus.
course, sure.
I even created a group, 40
Right.
plus fabulous infertile. I said, you know
Yeah,
what? This is
come
what
on.
God wants from me.
Come
Yeah.
on.
I mean, he pulled me out of the pelvic reconstruction world and just dropped me into fertility. Okay, guy.
What
All
am
right,
I
gotcha.
doing here?
So here we are. And so what I tell all of my patients is, especially when they start getting into that sad, dark space, and even younger will get into the dark space, or like the clock is ticking.
Right,
That's like
sure.
the wrong
Urgency,
space,
yeah.
right? Is, look, what's the worst thing that could happen? The worst thing that could happen is donor eggs, right? That's the worst thing that could happen. That's not really that bad,
Right.
right?
Right.
And think about it. The average age of a donor is 25. So there's no clock ticking, because there'll be another 25-year-old, and in another year there's another 25-year-old, and then the next year there's another 25-year-old.
Right.
That choice is always there.
Yeah.
Right.
Okay? So now that we can breathe, right? We got that choice, relax.
Shalom.
Then now let's see how far you want to push this.
Right.
Yeah.
What are you willing to do?
Let's go. Yeah, it's good. Okay.
And I want to congratulate you, both of you, on your journey.
Thank you.
Okay, for many reasons. I think one of the reasons that God has taken me through the journey that He has, including the pelvic and all this stuff, is that we're in a world that it's a weird world these days, right? Because we're very much into not bullying anybody, but then we bully certain groups, but other groups should not be touched, and it's just kind of a weird place to be.
Yeah.
And maybe it's because I am in the same age group, and I understand all the dynamics that brings you here, and why somebody like you might have decided at this stage of your life to expand your family. People in their 40s and 50s trying to have a baby, they get bullied like there's no tomorrow. And you know what the sad part is? Everybody feels that they are entitled to bully them.
Right.
Like, it's crazy. Like, they don't get the same service. They don't get the same options. And I don't think that's fair. I don't think it's fair for your beautiful wife to go into an office, and just because of her age, she's not even given the chance.
Yeah.
Right.
Right? Or even I get bullied for giving her a chance. How
Yeah.
dare you do
Right.
that to her? I was like, what? I'm not doing anything. I'm giving her choices.
Yeah.
And life is about going through the life experience, and we only literally live once. And so there's studies that show that people on their deathbed, you know, the recurrent subject is, I should have.
Regrets.
Right.
Yep.
I should have, you know, made peace with this person. I should have taken that trip. I should have blah, 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 blah.
So true.
So in this journey that you're both in, okay, you found your soulmate
Yes.
at a situation XYZ, it doesn't matter. Well, let's say that there is no baby in the map, right? I'm going to be a little fatalistic here. When you're done with your journey, there won't be a what if.
That's
Yeah.
right. That's right. I
You
agree.
took the
100%.
challenge.
Yeah.
You
100%.
lived. And the journey is as important as the end.
That's right.
Yeah.
We'll be better because
We're
of it,
fully aware of
regardless.
that.
You know what I'm
Regardless of
saying?
the outcome,
Yeah.
we know it's the
I'm
journey.
not saying, I'm just trying to put it like
It's
the
real.
worst scenario. But it really, you took that chance.
Yeah.
You did the you step outside of the box and follow your dreams. I tell my kids, I tell everybody, it's like the worst dream is the one that's not followed.
That's
The
right.
worst question is the one that's not asked.
So good. So true.
Absolutely.
So interesting enough, and I had asked you this. Now I ask you it again while we're recording. It's like, so Chantel is literally the first person to get reproductive stem cell treatment and then do in vitro. And the reason why she's doing in vitro, because all your other patients are trying to do it naturally, is because she has her tubes tied. Now, I was thinking about this, which is fantastic because that's pretty cool. Like the first woman ever
He
to
loves
go
being a
through
pioneer.
this. Yeah, I'm like, yes, she's the first.
Like, invigorates him.
So, yeah, I was, though, thinking about this because I saw something on the website because I was going through researching you about reconstructive, though, of the fallopian tubes.
Absolutely. I do it all the time.
Yes, I saw that. I'm like, I never asked her. It's like, well, you didn't ask, right? It's like, but for me, it's because I of course, it was many years ago. What was it, 20 plus years ago now? My previous wife, I think I shared this with you. We did reconstructive with her. She had her tubes tied too. Imagine that. 2 women that I married. She had 4 kids in 5 years. And then so she had her tubes tied because she was done having kids. And then we got married and we had the tubes tied together. They did it. We did the dye. One tube was completely open. The other one maybe kind of sort of, right? So again, and then all of a sudden they're telling us, oh, by the way, we can't guarantee after the surgery that the tubes will function to move the egg. So that might be what's happening. And I'm like, well, I'm not going through that again.
Yes.
So I'm just letting you know why we chose IVF. And then I'm going to ask you, like, with stem cell, right? You put the fallopian tubes back together,
And
do
you
the stem
flesh
cell
them.
treatment.
I
right?
do that.
So
I already
you're already
do that.
thinking about,
I mean,
well, you did the PRP.
with the PRP.
So I'm
I
curious, though,
usually-
would that be a better route?
Oh my God, I can't wait to be the first. Like I'm like dying to put my hands on somebody that
That would
wants to
let
do
you
a
do it,
tubal
yeah.
reversal
Right,
and then
and then-
flush them with the stem cells, because part of the challenge is functionality
Yeah,
post surgery. Yes, and then so like right now, I would flush the tubes with PRP to avoid scarring,
Right,
with
yeah,
healing, or
yeah.
I offer it to the patients with that
Sure.
purpose. But one of the things that I have in my to-do list is to include doing tubal reversal and then doing the stem cells right there and
Right.
then to
Well,
cause
so,
healing.
I mean, let's just go to I'm a numbers guy.
Mm-hmm.
So I'm going to ask you now on this recording. At least it's not live. We can edit it. But it's like, what's the higher percentage? I mean, if I was to do IVF and this time it didn't work, would it be wise then to say, well, let's go back to reconstructive and do this?
It might not, I mean, in your particular scenario, it might not be so crazy because you're dealing with low ovarian reserve. In my experience, somebody like Chantel would be a lot easier pregnant naturally because She doesn't yield a lot of eggs, but that doesn't mean they're abnormal. But IVF is very invasive and is very traumatic. You're suctioning the eggs, putting them in the lab, puncturing them, you know. And so I prefer to help women in their 40s, if they have at least one tube, get pregnant naturally.
Wow.
So it's not crazy because of where we're at, and it gives you, I mean, you still can do IVF, but it gives you the chance of double whammy. You know what I'm saying? Still work through it the old-fashioned way. I mean, doesn't everybody want to have a baby in the bedroom?
Yeah.
So much fun.
I mean, we practice all the time, so it's like, if it could work, I keep thinking it's going to be like osmosis. The sperm will go through somewhere, somehow, because there's so much.
It's just going to supernaturally move.
Yeah, it's just going to happen. So, okay. Now that brings me back to then what you just said, the invasive thing with injecting sperm. So I had a little issue with a situation that happened with us because I wanted it natural, meaning like, put the sperm.
IVF. Just let it be.
Let it happen.
And you can.
Yes, I know you can. But that was my challenge, was they didn't really ask us. They asked, but it wasn't clear what it was.
It was a formality in the paperwork.
And it's so interesting because I raised hell, I'll just be honest. I did. You probably didn't hear about it, or maybe you did. I sent an email. I called. I talked to the embryologist manager, and I was like, what the hell? Like, to me, this is a really big deal. Now you tell me I've got 2 embryos that you forced. I wanted it to happen because my sperm wanted her egg, and they, for me that was a big deal. But then I got over it.
Yes.
Because I wanted it to happen worse than I did.
And I mean, not to put more
fuel
in the fire.
Fuel on my fire. I know you're a holistic woman, so I knew it would.
On older women, there's some studies that say that just putting them together, because they're already frail.
Yeah.
Again, it's not an egg that necessarily is abnormal. It's a 44-year-old egg that needs a little bit more love handling.
Okay.
And so because of the puncturing and the assisted hatching, there might be a lot of manipulation on the embryo. So I actually had a patient who brought me the data because she had to fight not to have ICSI. She's 43 or something. It's like, but you have to request it and fight for it.
Yeah. And I'm like, to me, that seems like it should be. And matter of fact, because I went to the manager, the embryologist manager, and I was so upset. Like, Chantel's like, freaking calm down. It's okay. If we end up having a baby, isn't it worth it?
I'm supposed to be stress-free
and
right now.
And I was fired up. I was really mad. I was seeing red because I had this vision, right? Oh, my sperm and her egg, and they were just so in love. Like we are, that they would truly be attracted to each other. So then when it didn't happen, I was like furious. I'm like, tell me where I signed off on this because I didn't ask for this. And anyways, but the point was, it's like
they found it.
They found where I signed up, but it was one of those where sign here, sign here, sign here, sign here. Yeah. And I was like, that should be and so she's like, well, we'll note that. Maybe we'll bring it up to where it could be one of the questions that we ask and make sure your attention's there and double sign it or whatever and know what that means. Because you don't know what it means.
Correct.
I mean, I don't know the terms. Sign here and you're doing this. And I'm like, okay. So, but, okay. Thank you. We're going to do it that way this next time.
Very good.
You'll help us to make sure it happens because you're with us.
Now we're in this together. Now you're under my radar. Yes.
Oh, it's so awesome. Thank you. But yeah, that is interesting though. That would make a difference.
Yes.
Because it's like they want to be. It's almost like the same. Because to me that represented, like I put them both in a dish and they still happens. To me that's like similar what would happen in her body, right?
That is as close as what would happen in her body.
Yeah. Mm-hmm. It really encouraged me when I read about that. I was like, yeah, let's do this, babe. And then let's have it done that way. And I felt like I wasn't
taken away from
option.
you.
Yeah. Like it wasn't an option. But anyways, now it is. And now I know. And I got you in my corner. Let's go, coach. Okay, sorry. All right. So let's talk about, because I know this, we need to address this. We're like way over, dude. What time? I mean, we still got video going?
You guys have been going for an hour and 40 minutes.
Oh my goodness, you still got memory?
You're going to have to
yeah, we'll have to break it up into a series. But I hope you're feeling it, man. This is good stuff, right? So, okay. I do want to address a little bit how it affects like autoimmune diseases,
Yes.
cancer.
Oh my God.
Like, why does it work for these things?
So, for example, we were talking outside about natural killer cells. That's another form of cell therapy that is used for cancer as an what they call adjuvant. So, additional therapy. They play, for example, it helps shrink natural killer cells. It's your first line of defense.
Okay.
They are donated from young, healthy donors,
Right.
and they go and go kill the tumor. And it can be used in conjunction with stem cells and chemotherapy. And what it does, it helps the chemotherapy work better
Wow.
in lower doses.
Okay.
So there's a lot of data on that. And then or even using these stem cells as rescue therapy. So you hit them with the chemo, okay? And chemo, the way it works, it's a gamble, because your cells, your healthy cells, are actually stronger than your cancer cells. And so they're gambling, saying, okay, we know we're going to kill some of the good ones, but we're going to kill more of the bad ones.
So it's poisoning your body.
Correct.
On purpose.
So then, if you can give stem cells and exosomes and peptides on the week between chemos, it's almost like you're rescuing the survivors.
So how come it's not empowering the cancer cells? Tell me why.
Because they're dysfunctional. Because these stem cells are smart.
Okay.
So they can detect that they are abnormal, and they will only go rescue the normal cells.
That's amazing.
Isn't that cool?
Yeah.
And it has to do with regeneration, because almost like cancer cells are the
They're
the
completely
vibes they're
abnormal.
putting off, if you would,
Yes.
are negative and death, where they're restoring life.
Correct.
That's
Yes.
very
Yes.
basic terms. but-
Yes, that's essentially.
Okay.
And then you can combine, let's see, you can do natural killer cells. You go hit the tumor, finish it off with chemo, or vice versa, then rescue with stem cells.
That's so
Isn't that cool?
awesome.
Yeah. I think
And then
it's-
PRP in there, or does PRP
for
affect?
cancer,
cancer at all?
for
No.
PRP and cancer don't go together.
Okay, because the PRP has to do with regenerating healing the scars and tissues and things
Correct.
that need
And because
regeneration.
they are they're not smart.
Okay.
If you put PRP in the wrong place, you could potentially stimulate a tumor to grow. So
Okay.
I would
different
Yeah.
different way of doing things. Okay,
Yeah.
gotcha. Now, potential side effects from stem cell stuff would just have to do with the body, because I read a couple things. It was so fascinating to me that of all the research, I only found a couple. One had to do with like a tumor that showed up, but they couldn't directly link it to the stem cell. It could have been caused by something else, and the timing was just the same. And then another one had to do with just some inflammatory reactions, but they actually still got the good results on their kidney. They just had some inflammation, but the kidney still restored. So it still did its job, but they had some allergic reaction of some sort. Can you talk to that stuff about like what side effects? You talked about what happened to you, but in even like the cancer patients, like what's the risk of this stuff?
So, I mean, the risk of stem cells is fairly small. They've been studying it for over 20 years.
Okay.
And then, could there be a host versus graft reaction, transient? They even know how long they last in the body.
Okay.
They know that the IV infusion lasts 7 days. If it's given into the bone, because they use it for bone regeneration, it's 14 days. Intraperitoneal, 21 days. So the longest they're ever going to be in your body is 21 days. They will die off and get eliminated. So
for 21 days, they're regenerating.
correct. And that's part of why I put intraperitoneal cells in your pelvis, to extend the life of the stem cells and hopefully get a little bit more oomph in there.
Gotcha. So you literally just like did shots with a needle, or how did it work?
Yep. Since
Okay.
since her tubes were tied, so
Right.
yes, I did them with a needle while she was asleep.
So that's why I was so bloated.
Bloated.
For so
Yeah.
long. I
Yes,
was like,
that's
Yeah.
why
"Ugh."
you were like, what the hell did she do?
Man, I ate something and I was like,
Yes, you had a lot of fluid in there.
Yeah, and our AMH levels are up too. We kind of didn't really address that you just got those results back. That's pretty awesome.
Yep.
That those are up. and
Yeah.
we're hoping to continue to see them go up, right? Okay, so another question is about pregnancy. Is there anybody that's actually pregnant yet? I know we're only 2 months in. Any
So
reports back?
there's nobody pregnant yet. We had people spontaneously ovulate that were not ovulating before.
Okay.
We had one of the girls that were in the waiting time. She did go through an artificial insemination, so we're kind of crossing
Gotcha.
our fingers.
Mm-hmm.
So we're still kind of waiting. Everybody's starting to get their baselines and being touching base with some of the ladies.
So I mean, it is like, so just so the audience understands, again, you're dealing with people that are over 40. All the statistics are against them. So you're
Yes.
actually regenerating them first. That's why it might actually
Yes.
take a little bit of
A
time
little bit of time.
for all the reproductive organs to
To
regenerate and
correct.
then be able to produce
Correct.
baby.
And again, I talk to them about diet and supplements, anything that you can work, acupuncture, spirituality, anything that is going to add to that project, because it's almost like you get a little bit of here, a little bit here,
Yeah.
and there'll be a point where that balance is going to tilt in your favor.
Right.
It all adds up.
How much have you studied about fasting? Because this has come up.
Oh, huge. I mean, I am a fervent believer in faster. I actually, send a patient to do a prolonged fasting for a tumor in a
Okay.
pituitary. I believe in it like to my core, and I am dying to do a prolonged fast, 7 days.
Okay, 5 to 7 days. Okay.
It's in my heart. It's been in my heart for a long time. I've spoken to people that have done it.
Let's do it.
I want to do it, but I know I need to. This is not me being a chicken.
I love it. I love your accent.
I've done intermittent. I've gone as far as like 48 hours. And so, but my lifestyle and my household situation, it's very, very hard when that hunger kicks in and you have to feed somebody else.
Yeah.
Or, my job is very stressful, as you can imagine. And level of stress goes up. It's harder to keep up with it, right?
Sure.
You need to go to a
Oh,
very
yeah.
spiritual space.
Absolutely. I just finished a 72, actually 72 hour
Yeah,
one.
so I'm dying to do a prolonged one. I fervent believe in all the benefits. I've done the research. I follow a few PhDs because that's part of the anti-aging movement.
Yeah, I mean it's fascinating. The Bible talks about it, and you see before they
Huge.
made any major decision, they
Decisions.
would fast, right? Any
Correct.
major thing, and that's what
Correct.
I've lived my life by. Like 72 hours seems to be my little niche. I've actually every year on New Year's, I've always done 72 hours for like, I don't know, the past 5 or 6 years. But even recently, I've started to do it more, which is fascinating then to learn more about it as we're studying the science. What's the doctor?
So
you plug into?
studying regenerative health, right?
Correct.
You're familiar with Dr. Mindy Peltz?
No, I followed a few. I followed Dr. Longo out of California.
Okay.
He's in University of UCLA, and all his research on fasting. And then I've come across a few of the fasting gurus, and I know the benefits, and I recommend even intermittent fasting on people.
Yeah,
I
We do
even
it.
have a fasting plan that I give my patients.
It's costed me 50 pounds, which I'm grateful to have shed and lose and not find it ever
Yes.
again, but dropped it. But yeah, that's the fasting. It finally broke through my insulin issues because I am, my everyone on my dad's side, when I say everyone, aunts, uncles, everyone does insulin. I do not do insulin, thank God. I'm grateful for that.
Yes, and
type 2 diabetes is rampant in my Hispanic family.
and so for example, if you were to do, because the miracle happens at day 5, that's why I'm like, I want to do it day 7, I want to do it day 7, and all the apoptosis regeneration, blah blah blah.
Yeah, I've done 7. I've done 7
so
before. It's awesome.
but I know I need to be ready for it.
Yeah.
Right.
It is very spiritual, by
It
the way.
is.
For me, it was always for spiritual reasons, which is so fascinating. I have some friends that have done 40 days,
Oh my goodness.
you know, again, mimicking Jesus. But I wonder, too, like his example of doing that, like what regeneration would take place. And then you've got these, I watched a series about a guy that doesn't even have to eat, supposedly, you know, just the sunlight.
Aeritarian.
I heard something like that.
Wow. I mean, okay.
Well,
but anyway,
when you
sorry.
get really esoteric, which I am all for that. I mean, if you think about what are we and the definition of matter, which is condensed light,
Yeah.
you know, we are mostly air. We are a spiritual being having a physical experience.
Absolutely.
So, and I think that we don't quite understand, because I think that the piece of the divine in us has to forget who it was so it can experience mortality. And so because of that, you know, sometimes we get too much into the flesh and forget that connection. So that's where it's a brain game to
Absolutely.
fast, because
Right.
what I've heard is once you hit that third day, you're not hungry anymore.
Yeah.
Right.
Yeah. Agreed. And fifth, it just gets more. And then the craziest thing about it when I've done it is the senses are so heightened. I can smell every fragrance. I know this sounds terrible, but I can smell like people's body odor and whether what time of the month they're on. Like it's very strong.
Wow.
And very sensitive to energy too, like feeling people's energy and what
energy. I
they're
bet.
what they're going
You know,
through.
I
It's
spoke
amazing.
to, because I'm so after my journey, so after I did all of the naturopath and the alternative physical stuff, I went into the let's get crazy spiritual,
Yeah.
right? So
Guru.
you know, woo. So, you know, I'm like, I've spoken to multiple spiritual leaders of different denominations,
Yep.
and then all of the mystical experience they have while they're fasting or prolonged prayer meditation. So, you know, actually that's how I met Ricardo. I went to a spiritual retreat and he
Amazing.
just happened to be at the hotel.
Yes.
There you go.
But
Divine
That's
appointments.
that's yeah, the divine
That's right.
appointments. That's another story.
So I want to ask you about fasting specifically for women and the
Huge.
hormones.
Huge,
Right.
because of the insulin, and you know, it resets your body. So again, I recommend fasting for overall health, endocrine health. Huge. It gives your body a time to regenerate, reset. Insulin gets reset. Insulin drives a lot of the ovarian disorders.
Right.
So it's like, I can't speak about it enough.
So as far as though our cycles,
Oh, like meaning when to fast.
when to fast
So
according to
yeah.
your hormone levels, your
So-
cycles, and all of those kind of things.
Yeah, so
What are your thoughts on
I don't
those?
have any particular thoughts. I know that in many traditions, women are told not to fast during their periods, which
During their period?
during their
or
periods.
before?
during their periods, because they are already eliminating part of the process. So you know, they could get a little more weak. But I personally think any day is a great day to fast.
Interesting. Okay.
Interesting thing about stem cells. When I got that shot, the peptides, right, in the booty, I haven't had this kind of dream in a long time. I'm a dreamer. And I woke up and I told Chantel, I'm like, holy crap, I spent the night dreaming about flying again. And I hadn't flown in my dreams in a very long time. Whether it's, you know, whatever it's connected to, it's not like I control the dreams. And it's always this cool feeling of spiritual, like coming from my belly and flying, and it's almost like a jump fly. I could totally describe it. And I remember having those when I was younger.
Yeah,
And
I
it's
used
so
to fly in my
interesting.
youth too,
Yeah.
but I haven't flown
interesting.
in a long time.
Do 3 million and then you'll fly.
Right?
No, that sounds bad. It's not like that. That's what it's for. But that sounds bad. Like, but it is funny that those, you know, anyways, it's good. It's good. All right. So, but let's talk about, like, even real quick to finalize some things, again, going back to the autoimmune stuff and the cancer treatment. Like, what would you recommend? Like, what are some success stories that you can talk about that have been treated with the patients from stem cell stuff, and what if people are interested? How do they get
Absolutely.
started with you, or how do we?
Absolutely.
do?
So when I put my video out that I was like doing stem cells, and then there was this stem cell group that reached out and so forth. I got a lot of interest, which is it's good. But it was like, okay, let me sign me up. I'm like, no, that's not the way I do things. That's just not. They still have to have a consult. This is another tool in the toolbox, but the reality is that you still have to become my patient. We're going to do a protocol, okay, that includes everything and potentially the stem cells. So, they're welcome to call the office, make an appointment, a virtual appointment, whatever it's needed, so we can go over their history, so I can really do a thorough protocol for them. In terms of success stories, I told you about the COVID patients, the autistic children that are getting treated with very good results, especially they get calmer. It calms their brain.
Wow.
It helps regenerate some of the nerve connections, but and that's where the anxiety, depression factor comes in. Tumors, there's a few case studies on lymphoma, and cancer related to the blood, and having really good results with that type of cancer. They have a lot of data on diabetes, like end organ diabetes, both in type 1 and type 2 diabetes, and reversing some of the damage associated with diabetes, even on the eyes, as long as it's diabetic retinopathy. And that's, again, going circle, that's why if it's helping other organs, I thought, well, it should definitely help fertility too.
Yeah.
But there's plenty of data on that. The Barcelona medical director, he was saying how these soccer players are worth millions of dollars. So when they have an injury, for example, it costs millions of dollars to have them sitting in the bench.
Yeah.
So they're trying to figure out how to heal them faster. So they're using PRP and stem cell therapy to accelerate the healing process, and they have been able to shorten the healing process that's normally 3 to 6 months to 6 weeks. They're back back playing.
Wow.
And that was part of his lecture, just showing like the x-rays, like broken bones, boom, like completely healed.
What age group?
They're young, in their 20s,
Still,
30s.
it's normally 6 to 8 weeks.
But it's normally 3 months, especially depending on how severe the injury.
Like our son had torn his labrum twice playing rugby.
That's right. That's what I'm saying. And it's a hard process. Well, they combine it with everything again, full, physical therapy, occasional surgery, and then stem cells and PRP, and they're back on the game. They're back on the game.
That's unbelievable.
That is amazing.
Awesome.
Wow.
Well, it's an amazing journey with you.
Awesome.
We're
I'm
glad
sure
we're
it's
on
not
it.
over.
It's only just begun.
That's right.
It's just the beginning. The
It is.
universe, God does not waste a moment. Every experience is a building block for something.
Yeah, it's amazing to be a part of.
Thank you so much
pioneers.
for coming, doing this with us, and sharing with
Absolutely.
the world.
Sharing is
How
caring.
we're
And
pioneering.
giving is receiving. It's the law of the universe.
It is.
So
Reaping and
it's a
sowing is
pleasure.
real.
I can't wait for a miracle baby to arrive. It's
That's
like
right.
every time that the impossible happens, there's an intangible reward. A priceless reward. 'Cause
I think there's another chapter to the journey, though. Again, in vitro, we want to hope that it's going to work this next time, but maybe it is. Maybe it is the
tubes.
tubes. Who knows? I mean, you've done those surgeries,
wheels
so
are
it's
gonna be
just like,
spinning now.
and we'll have to do it in Mexico then,
yeah,
right? Because then you have to do the
absolutely.
stem cell treatment, and
right there and then. And
which is another good question. So right now, because it's in research, you've got some incredible facilities. My goodness, I'm telling you, amazing facilities in Mexico that we got to be a part of. Really clean. It was amazing. And
so what is the next step?
Yeah, what is, I mean, yeah, how does that develop more for you? Because the demand's going to get higher as word gets
So
out.
we're working through those kinks, and we're trying to make it a lot more organized, such that it's a lot more fluid. You know, we're thinking of even, I mean, Dr. Nadio and his team, they have a small clinic that is not really set up for medical or GYN. It's really an infusion clinic. You guys did not get to see that clinic. And so we're hoping to maybe move together into a facility that his team can
handle
use
all of it.
all of it in one spot. So
Beautiful.
that's hopefully the next frontier. Facilitate the process for everybody coming in terms of, I mean, we did have some transportation people that got recommended, but having it more fluid,
Right.
right? That
So
type
there's
of
a lot
thing.
of potential, and this is
Abs-
just the beginning.
This is just the beginning. This is just, I'm very excited.
And we're excited to be a part of it with you.
Yes.
Seriously.
I'm
Because
very
we love helping
excited.
people, and we love, you know, we always say that we lead by example too. Like, we won't ask others to do things unless we've done it ourselves.
That's right,
too,
because
so.
it's, you know, call it, in the Bible it says that you reap what you sow, or you sow what you reap. And in Hindu is karma. You do good, you do the right thing in the right way, and somehow it pays back. So, for example, when I was going through my challenges with my teenage daughters, I was still seeing teenagers at the time. I was like, you know what? Even though I am a doctor and I'm a gynecologist, I'm still stupid mom in my house. So I will put all my energy and effort helping another mom handle their child and taking her the right way. And I know God will put the right person in my daughter's life, because it's all the circle of life. It's all that, you know, healing circle.
Healing circle. So good. And so then the term, is this a normal term like you mentioned before when we had conversation about medical tourism? That's kind of a new thing, kind of.
Correct.
coming
So,
up now.
I mean, it's not new. It's
Okay,
No.
not new,
It
I've
but
been
is.
going
a
on to
new term
Mexico
for
for
me.
dental work for
it is
ever.
booming, and
Yeah.
it's going to just get bigger. Even for me, for example, as a doctor, I need to sigh. So, I became a doctor because I like to help people, right? And I'm a surgeon. And when I know you need this surgery, and let's say you don't have insurance, right? And then I go and knock on doors to get you a place to do the surgery. And then when all of the, the surgery fee, then this anesthesia fee, there's the other fee, and I haven't even added my own fee.
Right.
And it's undoable. I mean, who has $30,000 in the bank to do a surgery?
Right.
And then, so it's like the middle class in this country is getting cremated.
Yeah.
And so, if you're on the lower class and you can qualify for Medicaid, then you're okay. You can find health care. If you can afford the insurance, you can find health care, even though I have my feelings on it. But then it's the people in the middle. Yeah. They get squeezed, and it kills me.
And
it just
doctor.
makes me, oh yeah, my God. I can go on about that one too. That's why I said about the insurance.
Right,
People, unfortunately, they think, oh, well, the insurance is paying the doctor. No, the insurance is keeping the money. But
they're paying
themselves.
Possible.
Let's put it that way. The CEO of the insurance company is the one driving the Mercedes.
That's right.
So, but anyway, that's on the side. But yeah, so I think that because, there's inflation and that is going to keep rising prices, we're going to see more and more people looking for healthcare outside of the United States.
Yeah. Well, and with this being in the research mode, last final question, I promise. It's like one of the things we talked about is the ethics of it, right? Like, this is only going to be for the rich. But I love your heart that you do have the heart to help everyone that you can. And so a portion of what you're going to be doing, you're going to be allowing it to possibly have some
absolutely, and that's
grants, if you would, through
Yes.
your other
Yes,
society.
so,
What are you doing? You're going to do that.
So, going back to the book,
yes.
I think that when a few years ago, and we were talking about the dark moment of the soul,
Right.
I looked up. When you're down in the barrel, there's only one place to look. It's up.
Yep.
And so I really had a heart-to-heart talk with God and said, okay, lead. I will follow, right? Your plan is going to be definitely better than mine because I've been sucking on my plans. So the book happened, it started here, ended there, and it kind of opened my mind. It is about pioneers.
Yeah.
It is about the patients taking the challenge. It is about helping the patients, right? So that has stimulated. So I am created a not-for-profit.
Yes. Okay.
So to be able to have a scientific research area where we can bring those technologies and offer them in a safe environment within the rules of the game, right? And then be able to also provide grants for people who need this. I have one of the patients described in the book. She was in the wrong place at the wrong time, and she got a shot in the arm that damaged her brachial plexus, which are the nerves that feed the left arm. And so she got disabled for an accident. And so she's being, battling the system. When we met, she was, self-esteem on the floor, very her energy was down. So I've been working with her with PRP in the physical therapy and everything else to help her. She's gained a lot of motility in her arm and spirits, but she doesn't have the funds to go to Mexico and get it to the next level, which I would love to give her. So, I want to be able to raise funds and allow people that maybe can't afford this type of therapies to be able to get them.
Yes.
Okay.
Yes.
And I would love to be able to offer reasonable price surgeries and stuff like that. So that's kind of
awesome.
in my to-do
awesome.
list.
Well, and it's part of the process, right?
It's
It's just getting started. As it grows, you'll have more funds and more ability to do
Absolutely.
the
We're actually launching the
stuff.
non-for-profit on May 20th.
Awesome.
And it's about people healing people. It's about the healing circles, right? Because you help somebody stand up, you help that person heal. They give you back, because sometimes through our pain, other people heal, and then we heal with them.
So good.
And then you empower people that go empower their families and go empower their communities. And so that's kind of the underlying motto for the Healing Circles non-for-profit.
Awesome.
So good.
I love it.
Restore Health. Dr. Verdiales, Dr. V. And if you, the first step is just to get a hold of you through your facility, through your clinic, or
That's right.
contact us. We'll put you in touch with her. We'll make sure you get a hold of her and get the process started.
Well,
That's
thank you
important.
for having me, and I'm sure we'll see each other quite a bit in the next few years.
Let's do this. I mean, we're on a new frontier here.
Awesome.
So good
stuff.
Thank you.
All
Thank
right.
you so much.
Bye-bye.
Oh, you do it. And
You do it.
what's it? How do we say it? We almost forget. If you like the content that we're producing, please like and comment below, and then hit the notification bell. And then when we go live or we create new content just like this, you can be notified. Thanks for watching.